Hi, Sheila. My name is Amber, and I wanted to respond to your post for this week's discussion board on maternal and postpartum suicide. The first thing that you mentioned that I thought was really interesting was cited by the maternal mental health, that maternal anxiety and depression are the most common complications of childbirth, impacting up to 1 in 5 women. I thought those statistics were really interesting, but yet they are not universally screened for nor treated. And you're right. As a mom of 5 who's given birth 5 times, nobody ever screened nor asked me questions that I can recall. I did have one pediatrician ask me at one point if I was struggling with depression, and it really caught me off guard the way he asked me. So I would think his approach could have been a lot better. And so this kind of leads into your discussion in your post talking about preventable factors when it comes in regard to inadequate interaction between the patient and the care systems, and just how important that is. You mentioned a French study that found that non-optimal care was present in 72% of the cases, and 91% of suicides were potentially preventable. And that's really hard to hear and hard to read, and also very sobering. And so being more conscious and aware is not only mental health providers, but really impacting the healthcare system and maternal care, and how we can be more preventative in our care is important. I found a study, I'm pulling it up right now. That is not it. That was done in New South Wales. Am I saying that? North South Wales? No, New South Wales. Which basically it studied maternal deaths and from non-medical causes, specifically suicide and trauma in the first year following death. And I'm gonna make sure I said this right. It's New South Wales. But basically their study found that prenatal services are often constructed to provide short-term support and long-term identification and support of women at particular risk of maternal death due to suicide and trauma in the first year following birth may help lower the incidence of maternal deaths. And so this kind of just plays into the conversation even more of how important it is for preventative care and even implementing mental health care for women, and screening and just getting on the front end. And because a lot of times, even if they're not getting prenatal care, if there's an emergency room visit or something of that nature, they're going to be the first ones to catch it. And so anyways, thank you so much. I enjoyed reading your post, and we will talk soon.